My lab is interested in the potential association between pathological processes in the pancreas and Alzheimer's disease. So just to give you an example, we found that the amylin, which is a hormone that is implicated in regulating satiation and is synthesized and constituted with insulin, crosses the blood-brain barrier, but also interacts with beta amyloid and is forming amyloid plaques. So co-deposition of amylin and beta amyloid in the brain and also in the cerebrovasculature. Now, in the pancreas, in patients with type 2 diabetes, amylin is also making the amyloid. In fact, this is the major pathological processes that it has been described in patients with type 2 diabetes. And and that it's a 95% of the pancreatic tissues that were investigated post-mortem. So it's a very common process in patients that have type 2 diabetes. So in the pancreas, formation of amyloid, of amylin-Aβ, it's inducing inflammation. Yeah, so it's triggering the NLRP3 inflammasome, and that leads to pro-inflammatory markers like IL-1β. Now, we showed that in the past that there is an association between accumulation of amylin in the cerebrovasculature and increased accumulation of IL-1β in the brain. Yeah. So now we are trying to understand what are the processes, what triggers what. Is the amylin that triggers the NLRP3 inflammasome in the brain, and or the IL-1β that is secreted from the pancreas, it's a trigger of the neuroinflammation in the brain. Yeah. So here, what we are going to present is that, first of all, there is an association between the increased level of amylin in the circulation and also increased marker of the inflammation systemically. So, for instance, the circulating monocytes are engulfing the amylin that is from the pancreas. Yeah, this doesn't happen in normal conditions. So the fact that the circulating monocytes are engulfing amylin from the pancreas only in individuals that have Alzheimer or dementia, that it's giving us the idea that, in fact, under circumstances that we don't clearly understand, there is a systemic inflammation that appears to be triggered from the pancreas. Yeah. Now, what is the impact, we believe, on the brain microvasculature? First of all, because there is a systemic inflammation, and those monocytes start accumulating the microvasculature, that it means that there is a risk for cerebrovascular inflammation that is triggered by the amylin accumulation in the microvasculature. Yeah. So we tested the hypothesis that amylin accumulation in the microvasculature associated with the cerebrovascular inflammation is one of the pathological processes that might actually lower the transport of the beta amyloid from the brain into the blood. So in other words, that the amylin pathology is one of the mechanisms that is associated with lower clearance of the beta amyloid from the brain. And that is what is the main message that we are trying to deliver to my talk. And in my talk, I will present data from humans showing the association between the cerebrovascular amylin pathology and formation of amylin, beta amyloid co-deposition in the brain microvasculature, and also use an animal model, a transgenic animal model, transgenic rat model to show mechanistically that this process is a mechanism underlying the increased risk for amylin beta amyloid co-deposition in the brain.